Doctors ACO is a group of independent physicians whose mission is to improve quality healthcare in the United States while reducing cost. Accountable care organizations save Medicare money by reducing fraud, waste, inefficiency, and unnecessary tests and treatment. Medicare has learned that the best way to do this is to incentivize doctors to help control cost. Doctors control almost all medical expenditures. The first steps to success in the ACO is to complete annual wellness visits. Annual wellness visits are not physical exams. Annual wellness visits save Medicare money by identifying preventable medical conditions. It increases revenue for your practice. It increases number of Medicare beneficiaries assigned to your practice in the doctor's ACO. Doctors ACO wants primary physicians to complete annual wellness visits in their office every year as suggested by Medicare. This helps to set a goal for patient care and also gives an opportunity for physicians to go through all preventive measures to improve the health of their patients. Doctors ACO would like for you to complete this annual visit on 100% of all Medicare patients, including Medicare Advantage plans. In order to help you identify a patient who may have not had an annual wellness visit, Medicare has given you an internet-based tool to check your patient's eligibility. This tool is called CAHABA GBA Insight. We have used this tool in our practice and have found it to be successful. It is free to all practices who accept Medicare. If you have any trouble, please contact Doctors ACO for assistance. To get ready for registration on CAHABA Insight, first you'll need your Provider Transaction Access Number, or PTAN. This is an identifier used by Medicare. It is also known as the provider number, Medicare PIN, or Medicare ID number. It is not the same as your NPI or tax ID number. Example, 211G777396. Next, you will need your National Provider Identifier, or NPI number. This is a unique 10-digit identification number issued to healthcare providers. Example, 123-654-9879. Then you'll need your Taxpayer Identification Number, or TIN. This is a 9-digit number used as a tracking number by the IRS. Example, 987-456-321. You will also need a Medicare claims check that has been paid to you within the last 90 days. You will need that check number and amount paid. This will help Insight confirm identity. If you are having trouble finding these numbers, you can access them on the National Provider Portal using the URL www.nppes.cms.nns.gov. You want to have your personal information ready as well. Each practice should choose a trusted employee to be the local security officer. You will need the first and last name of the person assigned to access this account and their email address. You will also need to create a user ID that consists of only 4 letters and only 3 numbers. Example, ABCD123. You will also need to create a password. This password has to be between 8 and 30 characters long and meet 3 of the 4 requirements. It must contain 1 letter, 1 number, 1 uppercase letter, and 1 special character. What is Insight? Insight is a system to find Medicare beneficiary eligibility and entitlement. It shows patient eligibility dates, services that have been completed, and how much Medicare has paid for these services in the past 3 years. What do you get out of it? Insight gives better support that the practice and provider needs by expanding their options for obtaining information quickly, efficiently, and on your own. such as Medicare Advantage information, home health information, preventative services, and other important patient information. Why practice use Insight on a daily basis? To ensure every patient has had all preventative services provided to them for optimal health and to improve quality care. To access Insight, go to your browser and enter the URL www.cahabagba.com. Please have all 8 of our required documents ready. 1. Provider Transaction Access Number. 2. National Provider Identifier. 3. Taxpayer Identification Number. 4. Medicare Claims Check or Remittance Notice. 5. First and last name of the person assigned to access the account. 6. An email address. 7. User ID. And 8. Password. If you have any questions or need assistance, please contact us at Doctors ACO.